South Australia Health ignored warnings that someone would be killed under one of its patient transfer policies months before an inpatient died in a head-on crash, an ABC investigation has revealed. On October 18 last year, a 72-year-old patient from Remark Hospital was driving himself to the Riverlab General Hospital at Berry, when he collided with a truck and died. The man's wife, who was a passenger in the car, suffered serious injuries and spent several months in hospital. Emails obtained by the ABC revealed Senior South Australia Medical Imaging, SAMI, manager Con Capsis warned of such a tragedy months before the fatal crash. Unfortunately, at my last meeting with CHSA, Country Health South Australia, several months ago I did predict that these adverse patient incident alerts, near misses and issues highlighted would ultimately lead to a death, Mr. Capsis said. There should not be a different set of standards for patients in South Australia Health in metro or in regional areas. At the time of the crash, it was normal process in the Riverlab for patients to use a private car instead of an ambulance, when the patient did not need clinical care during the transfer. At the time of the fatal accident, CHSA was preparing to begin a trial to allow patients in need of medical scans to use private vehicles to travel to other hospitals. Under that trial, CHSA agreed to provide nursing staff to care for patients awaiting and subsequent to their radiology test. It would still provide nursing staff during a transfer when it was clinically required. SAMI refused to take part though, saying the approach went against basic patient care principles. The CHSA transfer policy is not acceptable not only to me and private medical imaging providers, but it is the position of SAMI EMT, Executive Management Team, Mr. Capsis said. No SAMI site will be participating in any trial regarding the current CHSA, private vehicle, transfer policy. But SAMI's position was overruled and the trial began in November 2016, about a month after the Remark man's death. While I agree that CHSA's policy may need a review following the tragic death of a patient in a car accident in the Riverlab, let's not lose sight of the fact that ambulances can also have accidents, Riverlab and Mallicurug Regional Director Wayne Champion replied in an email. It is possible the patient's medical condition contributed to the accident. However, the policy does require that patients are risk assessed prior to a transfer. Mr. Champion said it was not practicable for patients to have a nurse escort for every transfer. Sending staff from a remote site with a patient who is assessed by their treating medical officer as not needing clinical care during the transfer puts our small, minimally staffed services at risk, he said. Hospitals aren't always able to call in replacement staff at short notice. Soon after the accident, South Australia Health told the ABC the man had been released into the care of his family to travel to the Riverlab General Hospital for scans. But the ABC understands the man's wife was never told her husband should not be driving due to his condition. About a fortnight after the accident, a new mandatory form requiring a doctor's signature was introduced for sending sites looking to transfer a patient to another hospital in a private car.